All right. Um, Thank you guys all so much for joining me today. We are very excited to have you all here to listen to some five amazing companies that have been working really hard as a part of the Blue Cross Blue Shield Massachusetts Health Equity Business Accelerator. So thank you so much for joining. We really appreciate your commitment to health equity and your participation in being champions of healthcare, as evidenced by your attendance here today. So as the audience is gathering, we're just going to give you a quick overview of a little bit of information about why we're here today and what the group has been working on. And we've got a really fantastic lineup, so we won't spend too much time on that. We'll get right to the good stuff. Just real quick, giving you a little bit of background on Healthbox and why we are here today and how we're participating in this. You know, we're really honored to be able to support this program as advisors, working with Blue Cross Blue Shield of Massachusetts by really working with the startups through product strategy, go-to-market strategy, fundraising strategy. And Healthbox really has a history in this. So we actually started over 10 years ago. We were one of the first firms to combine our investing experience and consulting services to drive innovation and digital transformation. And so we've done that through running 13 Accelerator programs, managing 2 strategic investment funds, evaluating over 4,000 companies for investment, and working with various health system and payer organizations on figuring out what their digital and innovation needs are. And so with that, I mean, it kind of brings us to why we're here today. Actually, in 2018, Healthbox became a wholly owned subsidiary of HIMSS. And HIMSS' mission, some of you may be familiar with HIMSS, global advisor, thought leader, member-based society. It has over 115,000 members across 86 countries. But our vision at HIMSS is to realize the full health potential of every human everywhere. And we do that through health and technology. But that really is what health equity is all about. Health equity is achieved when every person has the opportunity to attain his or her full health potential. So efforts towards health equity seek to address the systemic differences in health status, health outcomes for marginalized populations and other emerging issues. And so why does that matter? Well, because health equity is reflected and impacts length of life, quality of life, rates of disease, disability, death, severity of illness, access to treatment, and a lot more. And the impact of that, you know, these disparities amount to $93 billion in excess medical care costs, $42 billion in lost productivity, and, you know, a lot more in economic losses due to premature deaths. And we all know and have felt that COVID has had like an exacerbating impact on this. So we're going to hear examples today from these companies about how they're addressing that through access to medical transportation, education for culturally competent care, access for wellness benefits and remote monitoring, and mental health care. So these companies, they're taking real action. We're really excited for you to hear about those actions and to think about how you might be able to engage with them. And Blue Cross Blue Shield of Massachusetts has really set out to enable these companies through this Accelerator program. And with that, I would like to introduce kind of the visionary, the brains, the leader behind this, which is Michelle Corton-Brown, Vice President of Business Development at Blue Cross Blue Shield of Massachusetts. And so I will let her share her vision and some of the information about the program.
Thanks, Julie. And thank all of you for attending today's session. At Blue Cross Blue Shield, we've had a longstanding commitment to diversity, equity, and inclusion. It manifests itself in our employee engagement and our care work, where we've really focused on a partnership with providers to give them the data and resources they need to support improvements in health equity. And it also now lives in our strategic investment arm, Zaffer. And the program that you're here to learn more about in the portfolio companies that we're highlighting today are the first cohort of our Health Equity Business Accelerator program. The program was incubated in 2020, really in the height of both the pandemic, which Julie's already talked about, the significant health challenges that folks face in this country based on ethnicity, based on socioeconomic class, et cetera. But also the other disparity that became clear was that there is a disparity in the ability to innovate and to be entrepreneurial in this space. Research suggests that less than 3% of venture capital in 2020 was placed with BIPOC, LGBTQ women leaders in the space. And from our perch, we wanted to impact that in the way that we thought we could be useful of the resources that we have. So the program was set up with a general thesis that access to capital was number one with a bullet, what we needed to focus on. But in addition, we believe that the thesis suggested that technical assistance, access to that technical assistance, access to network, and access to deeper understandings and partnerships with the healthcare industry were also key triggers to accelerate the growth of BIPOC-led organizations. And armed with that thesis, we went out to the marketplace and did what we do with any other customer program or service that Blue Cross Blue Shield offers. We stress tested it with the target market that we were focused on. And so we went out, we spoke to close to 40 BIPOC-led organizations, and they proved out the theory that cash was important, but so was the development of that network and technical assistance and resources. And so it's one of the many reasons why we're delighted to be partnered with Julie and with Healthbox and also with the Capital Network to put together a surround sound program, if you will, that provides capital and resources. But I want to say that this cohort that you're going to meet are extraordinary leaders, that they are they've gone beyond proving out their product in theory, but they really have gone out and found customers. And we are so excited about the work they're doing and the opportunity for you to hear more about them. So on behalf of Blue Cross Blue Shield, I have a colleague on the phone, Jasmine Coleman, who's been the project manager of this program. I just want to give her a shout out. We are so excited for you to hear directly from these 5 amazing companies. And with that, I'm going to turn to Claire McGee. Claire?
All right, thank you so much. So I'll invite our first founder, Alicia, to start sharing her screen while I begin introductions. So first up, we have Alicia Chong Rodriguez, engineer, inventor, and founder of BloomerTech. BloomerTech is doing some incredible work creating female-specific predictive cardiac algorithms by embedding sensors into the everyday bra. Alicia has a rich history in hardware engineering, as well as extensive experience in generating initiatives for women in technology in Latin America. Alicia is also a graduate of MIT with a dual master's in integrated design and management and electrical engineering and computer science. She is the recipient of numerous awards, including the MIT Graduate Women of Excellence Award and a scholarship by Google for the Global Solutions Program of Singularity University. Alicia, take it away.
Thank you, and thank you so much for having me here as part of this amazing program. Hi, I'm Alicia. I'm the founder and CEO at BloomerTech, a company that is generating non-invasive digital biomarkers for women's health using advanced patented textile-based sensor technology like the one that you see in this image that can integrate easily into everyday clothing. And the reason that we're generating these digital biomarkers is because there's a huge data gap in healthcare. And as artificial intelligence helps turbocharge digital health, there's this danger that algorithms trained with mostly male datasets can actually perpetuate this problem. Even the FDA has shared a strategy to mitigate issues related to the underperformance of cardiovascular medical devices in women. There are 44 million women living in the US with heart disease, and the incidences for women under 65 are actually on a rise. So we have the opportunity to obtain women's physiological data that right now is lacking and generate these new digital biomarkers. It's a huge opportunity worth over $44 billion, and most importantly, saving and improving women's quality of life. So these are me and my co-founders, and we have built this out of MIT, as Claire mentioned. My background is in electrical engineering and computer science, and I did my thesis at the MIT Computational Cardiovascular Research Group. We all complement each other significantly, both in technical and design skills, as well as sharing how much we care about this huge problem that needs to be solved. We have all been impacted by heart disease and stroke in women around us. And with 1 in every 3 women developing heart diseases, in many cases with poor outcomes and that are even life-altering. And I'm going to share my co-founder's story, Monica, who actually lost her mom suddenly when her mom was 44 years old and she was only 12. 15 years after this has happened, we think that the standard of care hasn't changed enough to prevent something like what happened to Monica's mom from happening. And for this patient population, now we have amazing evidence that shows that heart disease and stroke present differently in women and the outcomes are poorer. And we now can use all of this evidence over the last 30 years to make change in how we solve this problem. So this is how we're doing it. We've created this augmented garment that gives women the ability to continuously and remotely acquire physiological data. And by wearing this bra, women can view insights and patterns and keep an automated journal on her phone with a simple way to tag symptoms and obtain life-saving data to share with her doctor for early detection and targeted management. We've built these medical-grade textile sensors to adapt to multiple sizes and bra styles for repeatable and reliable data that can look all around her torso, her heart, and her lungs. And we can track heart rhythm, breathing, temperature, posture, and movement. And when applying algorithms, we can use this data to decode symptoms, articulate arrhythmia triggers, and generate the personalized digital biomarkers, which, unlike traditional biomarkers like blood that take just a picture in time, these digital biomarkers work more like a video, using the data collected over time to explain, influence, and even predict health outcomes. They have the potential to enable care immediately and no more wait time for results. So we're using this platform that communicates via Bluetooth to an app and generates the reports for the physicians for huge search of generating novel digital biomarkers and getting enough information so that we can do the drug titration, a natural stress test, real world evidence, and decentralized clinical trials. And this is the amazing team that we've built around us, making it all happen. We have experts in bringing medical devices into the market that are category changing, developing new technologies for women's health, and even experts from the apparel industry. So all of this talent, along with our medical advisors and our industry advisors that are experts in bringing category changing solutions, has been huge for me and my co-founders, because we're making our dream to make an impact in this field happen, right? And like, thanks to opportunities like this, where we're looking into making huge changes in a field that has for way too long been overlooked, we're basically making strides because our device looks unlike anything that you've seen in the market today, and people are wearing it for long times, and we're seeing great results with it. So we're excited to invite you all to join us, right, to bring women's healthcare into the 21st century. If you're looking for new opportunities, please contact us. If you're running studies on medical devices and want to drive discovery further or recruit and retain female patients, please come talk to us if you want to partner with us. Thank you so much.
Thank you so much, Alicia. All right. So next up, we will welcome Erica Plybier to share her screen. Erica is an experienced healthcare expert and founder of MedHaul. MedHaul is a technology-driven benefit corporation that connects vulnerable patients to vital transportation resources. Before MedHaul, Erica spent 10 years developing and implementing large and small-scale software solutions in settings varying from one doctor practices to 1,000 plus bed hospitals for some of the biggest names in healthcare. Inspired by technology and lived experience, Erica strives to include the voices of those who have been left out of conversations when technology or advanced solutions are developed. All right, take it away, Erica.
Thank you, Claire. Good afternoon or good morning, everyone. I'm Erica Plivier, the founder of MedHaul, where we believe that everyone deserves safe, reliable, and efficient transportation to care, regardless of any special or unique needs. So to take a quick step back to expound upon what Claire shared with you, before MedHaul, I spent a decade in clinical and research informatics, building and deploying software solutions for some reputable names in healthcare like Epic, Flatiron Health, and most recently St. Jude Children's Research Hospital before I founded MedHaul. So think about my surprise and frustration when I could not find an easy way to transport my grandmother, who was a type 2 diabetic, double leg amputee, without having to lift her in and out of our family vehicle, which was not wheelchair accessible. I knew that there had to be a better way to find and book complex transportation for patients like my grandmother. And I later found out that millions of patients face this same problem across our country. So about 197 million people, about 60% of our population, have a chronic illness that requires daily or weekly trips to a doctor's appointment. And about a third of those miss those appointments due to transportation barriers, like not having a vehicle, not having the appropriate vehicle, or money for transportation. And so, and these are critical appointments that can't be missed. So think about a chemo patient missing, or a cancer patient missing chemo, or a kidney failure patient who can't make it to their clinic for dialysis. Many times these patients can't just drive themselves or hop on a bus and take public transportation, especially with the pandemic still in progress. And if these patients do miss these appointments, many times they end up calling 911 or going to the emergency room for what should have been a routine visit. These missed appointments and the misuse of emergency services are really hurting our patients, but also our healthcare system, creating avoidable expenses of over $180 billion per year. And of course, like many things in healthcare, health systems, insurance providers have tried to find suitable solutions for these patients, but unfortunately, the methods have been outdated and many times inefficient, usually requiring long stacks of paper, long phone calls. And the thing is, these patients are still continuing to miss their appointments, and healthcare providers are still losing time and money. Patients like my grandmother, caregivers like my mom, and the other 200 million patients across our country and our healthcare providers deserve better. So we started by building a solution for health organizations first. We built a tech-enabled marketplace that makes it easy to find and book high-quality transportation for vulnerable patients. In just a few clicks, we connect nursing staff directly with transportation partners who specialize in door-through-door transport for patients with complex needs, such as patients who are in wheelchairs, stretcher, patients who need isolation. We're also very intentional about targeting vulnerable communities, so low-income communities, elderly patients, and rural communities as well. Our secure technology also captures unique information on the platform. So does the patient own a wheelchair or will they need one? Are there stairs in or outside of the home? Ensuring that we connect the patient with the best transportation provider for both their physical and clinical needs. We have a phenomenal team who knows and really understands the population that MedHaul was built to serve. We have over 60 years of combined experience in digital health, social determinants of health, software engineering, logistics. We've successfully led over $700 million worth of complex projects for world-renowned health institutions and Fortune 500 companies. We've built technology products from the ground up for successful startups. So we believe we're really the right team to transform this massive non-emergency medical transportation industry. Since our formal launch in 2019, we've built and released 2 iterations of our technology secured 4 enterprise customers and facilitated over 9,000, almost 10,000 now rides to date. We saved our largest customer almost $2 million within their first year with us, and I'll talk a little bit more about that in a second. And we're not stopping there. We're hoping to expand our impact, targeting 200 enterprise customers, over 500,000 rides by 2025. In an exclusive partnership with a city's Office of Emergency Management and a local pediatric sickle cell clinic, we saw a couple of really great things. So first, a major increase in appointment attendance. Prior to the pilot with MedHaul for this particular case study, about 40% of these patients were attending their appointments on time. And after MedHaul, 92% of these patients were attending their appointments on time. We saw a huge decrease in the amount of time to book wheelchair and stretcher rides. So it was taking about 2.5 hours of nursing staff shift to call around to find different wheelchair transportation providers, determine their availability. We saw about 11 phone calls back and forth in 2.5 hours of non-consecutive time to book one ride for a patient. So we saw that time decrease from 2.5 hours to 2 minutes with the use of our platform. And we also saw a huge decrease in the use of emergency costs, so ambulance costs for the Office of Emergency Management. They saved about $2 million in booking transportation through the MedHaul platform instead of sending out ambulances for non-emergent reasons. There are other companies in this space that have tried to tackle various transportation challenges, but MedHaul is the first solution that focuses on personalized, complex transport in vulnerable communities. Healthcare providers tell us that they prefer to work with MedHaul first because of our mission, then because of our simple, predictable business models. We also have a very unique vetting process for finding reliable transportation providers, and our customers also enjoy and benefit from the wide variety of accessibility options that are offered on our platform. We have a really big mission, and we couldn't do this alone. We're extremely honored to be backed and supported by Blue Cross Blue Shield Massachusetts through this opportunity today. Also Citi, Morgan Stanley, Google for Startups, and many others. We're also looking for additional partners to help us fuel sales, expand our team, and product awareness. We're also always looking for, happy to partner with organizations to help them both understand and solve their transportation barriers for their vulnerable patient populations. I started MedHaul because I wanted to build a solution that would be available for my grandmother. She's unfortunately no longer here, but I am driven to scale the company to impact the hundreds of millions of patients across our country who need our help. So thank you for your time today. Please feel free to reach out.
Thank you so much, Erica. All right, next, we welcome Ashley Ogwedima, an accomplished educator and the COO of Quality Interactions. In her role, Ashley works to ensure that each aspect of the business is working in cohesion to deliver a superior curriculum to clients. Her passion for optimizing organizational structures as a vehicle to building out culturally competent educational spaces is rooted in her experience as an educator and educational leader. She holds a Master's of Education from Boston College and has over 10 years of experience working in school systems, shaping culturally competent policy, and establishing a people-first work and education culture that prioritizes equity, integrity, and empathy. Take it away.
Thank you, Claire, and good afternoon, everybody. My name is Ashley Ogwedima, as Claire shared, COO at Quality Interactions, a health equity and e-learning company that develops cultural competency training and assessment tools. We were founded by a trio of practicing physicians and researchers who are considered to be thought leaders in understanding health disparities and culturally competent communication. We're working with professionals in various healthcare settings to understand the root of implicit bias and provide them with the skills to communicate effectively with diverse patient populations. I'm sure many of you came today with your own understanding of what cultural competency is, but allow me to kind of ground us in the definition that we're using here at QI. This is a widely accepted definition of cultural competence from an article published by two of our founders, Joseph Betancourt and Emilio Carrillo, which simply highlight the ability for healthcare systems to provide care to patients of diverse values and backgrounds, and includes tailoring the patient's needs. I want to hone in a little bit on what it means for systems to tailor to diverse patients' needs. If we continue to turn a blind eye to culturally competent care, we'll see a significant human and financial cost to health disparities by way of patients either suffering or healthcare institutions spending in excess. You'll see here that the excess I speak of is $93 billion for medical care, $42 billion in lost productivity a year, and close to 125,000 lives lost due to medication non-adherence. With COVID and living in these times, I'm sure we all have known of someone or someone directly connected to us that have further contributed to that loss number. By any unit of measurement, the cost of health disparities is enormous. And many of those being impacted by health disparities are part of populations that are considered to be at risk. And those populations are only growing. We've learned that the population of age 65 or older is expected to double from 2016 to 2060. And 88% of immigrants and descendants will represent the total population number in the next 45 years. So the exponential growth alone of these diverse patient population further underscores the need for change. I'm sure many of you can think of a healthcare disparity that you've learned of, maybe through COVID or experienced yourself directly. Healthcare disparities are not new. However, our response to them is changing. Increased social engagement and overwhelming institutional recognition of impact of implicit bias from organizations like Black Lives Matter, where people are acknowledging the realities of the systemic racism and the need for disparities to be addressed at a systemic level, no longer blaming the population that's being targeted to solve the problem that needs to happen at a systemic level. So, so seeing organizations back those sentiments also from private institutions and state health authorities, larger associations like American Health Association and the CDC are taking stances on healthcare disparities and their need to be addressed in a direct way. The truth is, at QI, we've been here and doing this work. It's the mission orientation of our company. And now we're seeing the market finally finding the resources and gaining the momentum to truly engage. Here we've seen a huge growth in e-commerce for individual learners, as well as organizational contract sales. Traditionally, we've had great champions of this type of work at various organizations, but not always the backing from the health plan or the hospital or the system itself to put the money behind those training efforts. We're seeing that change drastically. People are saying that they can no longer afford to just maintain status quo. And these exponential growth numbers are every indication that we are in demand. So why are people choosing QI, you might ask? Well, we have a lot to say about what makes us different than some other competitors doing this work. Certainly, you see with the e-commerce component, we have comprehensive online store, which allows people who need to find this to maintain their licensure, or the organizational side of what we offer, a comprehensive course catalog to support organizational initiatives with a variety of courses, spanning foundational topics, as well as providing different versions for different job functions within healthcare. Our clients know that we'll consistently deliver on value. On the left, you'll see some of our repeat clients and the statistics of individual learners themselves here on the right. People are saying, oh, this has been a training that I've never experienced before, or I feel like I really can apply this to my practice. We're highly recommended and highly rated, continue to be recognized for having some of the most engaging trainings, even amongst people who've taken similar ones in the past. We're seeing in the pre and post-test knowledge gains that people are really walking away with a strong sense of applicability. With our clients in mind, we're focused on expanding 3 channels, as a response to how we plan to continue to deliver such a valuable product. Traditionally, or historically, I'd say, we really lived in this first bar of traditional contract sales, going to organizations and trying to really explain the importance of counteracting these type of healthcare disparities with education, and delivering a product over the years. I would say the last year and a half, we've seen tremendous growth in these other two bars, which only underscore how in demand we are. And people demanding that we want content, we do want it, and we want it in new and different ways. I would say in comparison to about 5 years ago. The three areas that we're looking to invest funds and have already seen success and simply hoping to grow further are our sales and marketing strategies, our e-commerce vehicle, and technology and customizing our LMS. One curated just for us, looking to truly optimize client engagement and increase user friendliness with the support of investor funding. With a $300,000 investment, we were able to generate close to $5 million in revenue. We believe that with the $1.5 million investment, we in our current market and with our current incredible team could generate to grow to be about a $10 million company. Now's our time, and we're hoping to meet the moment. I thank you so much for your time. And if you wish to connect on anything quality interactions related, please feel free to reach out to me directly. Thank you.
Thank you, Ashley. All right, next up, we'll welcome BJ Wiley-Williams to the stage, founder and CEO of SoHookd, an enterprise-based online wellness platform. She is a certified wellness nerd and fitness fanatic with 20 plus years of experience working in the wellness, hospitality, and private equity industry. BJ has been recognized as a well-being thought leader by the American College of Sports Medicine and by Marriott International. She has an MBA from Harvard Business School and a bachelor's from University of Virginia. She's on a mission to start a wellness revolution. She believes that we should reward people for the positive choices they're making in their lives. So she created a product that would inspire all of us in our inner quest for wellness. You're on mute, BJ.
Sorry about that. Thanks so much, Claire. I'm really excited to be here. Hi, everyone. I'm BJ Wiley-Williams. And as Claire mentioned, I'm the founder and CEO of SoHookd. SoHookd is a curated hub of wellness offerings used by employees to support their employees' well-being and drive engagement. Sort of think of the Netflix for wellness. So historically, desirable wellness was really omitted from the healthcare delivery model. Wellness enthusiasts like myself who wanted to elevate their mind, body, and soul, or really wanted to invest in those preventative practices, were left to supplement this lifestyle outside of their healthcare benefits. By definition, desirable wellness became a privilege. It was only accessible to those who are in the know or have the financial resources to access. Someone like myself who went to Harvard Business School and worked in industry-leading companies, I had access to the financial resources to navigate this luxury consumer wellness market. However, being an African-American female, I was really agitated by the narrative that wellness was only for the privileged, especially given the structure disproportionately affects Black and Brown folks. In reality, we all know wellness is a category desired across gender, ethnicity, and socioeconomic groups, which is why I founded SoHookd. I really believe that everyone should have access to aspirational offerings that fuel their mind, body, and soul, and thus we are focused on making wellness more inclusive, affordable, without sacrificing desirability, so that we can play our part in closing the wellness equity gap. So here's the problem for employers. The pandemic exacerbated a problem and a trend that was already gaining momentum. Over the past 2 years, the voice of the employee has been empowered and their influence has amplified. As part of the social contract, employees expect their employers to provide holistic wellness offerings to support their physical and mental self-care needs. And this has exposed the lack of internal preparedness across many organizations, and they can no longer support The turtle preparedness across many organizations and wellness offerings of the past no longer meet the needs of today's and tomorrow's consumers. Employers are losing talent and their workforce productivity is being diminished exponentially due to extreme burnout, poor company culture, and antiquated tools to combat the problem. This is costing huge amounts to the bottom line, and it's a problem organizations cannot afford to ignore. Supporting holistic well-being has become a top and urgent priority for employers. Wellness is no longer a perk, but a strategic business priority, with 6 out of 10 employees indicating it's a top priority when selecting a new job, and 8 out of 10 executives indicating it's a top priority for their organization. Today's employees expect their employers' response to preventative health benefits as much as clinical benefits, and employers are scrambling to determine how to provide solutions that are attractive and inclusive for their employees. So this is where SoHookd comes in. And SoHookd is an online wellness platform designed with the modern employee in mind. Our product is the SoHookd marketplace that consists of a variety of well-being offerings that employees actually want, from mental health, rest and recovery, healthy food, fitness, athletic apparel, and wellness tech. To align with employee expectations and to provide a breadth of choice, our marketplace is filled with offerings from leading national and global wellness brands across a variety of wellness categories. Employers no longer have to require their employees to venture into the office in order to engage with wellness activities, given our online platform complements a hybrid work model with 80% of our offerings being digitally based. To help enterprises drive engagement and boost morale, SoHooked's platform has online wellness programming from workshops and challenges as a way to streamline efforts for employees with an all-in-one high-impact solution. So let me just break this down a little bit further. Let's take Novant Health, for example. Novant Health is one of the largest healthcare networks in the Mid-Atlantic. Like many enterprises, probably many in the audience, especially those deeply impacted by the pandemic, their employees are burned out and are turning over. Novant partnered with SoHookd because they wanted to provide a self-care benefit and express appreciation in a way to boost morale and strengthen employee loyalty. The first step is all 36,000 employees received a stipend to the SoHookd marketplace. Next, Allison, a Novant employee, browses 200 plus offerings on the marketplace from healthy foods like brands like Blue Apron or AdMe, mental health resources from brands like BetterHelp, fitness from YogaWorks or 305 Fitness, sleep and recovery from Somni, urban wellness tech from Fitbit. Allison decides to redeem her stipend on her credit offerings that cater to her self-care needs and goals. One of the things that's really powerful is that it provides Allison the choice. Allison's happy, Novant's happy, which is why 8 out of their 10 employees are engaged in our platform. In addition, we offer 100 plus workshops and challenges to further drive engagement. Many organizations pair their wellness stipend or benefits with workshops to create more dimensional programs. So they'll host a workshop every month and a challenge every quarter. We're really excited with our impact to date, with over 70 enterprise customers and 80% retention since we've released our product in 2020. But what's really powerful is that we support companies ranging from American Tower to Harlem Children's Zones to even a Planned Parenthood, which really underscores the value that we're bringing access to wellness across a range of affordability, as well as a range of industries. In addition, we've activated a very powerful channel strategy with health plans and benefit brokers. You guys are probably familiar, but we discovered that many enterprises have these wellness funds sponsored by the health plan as part of their negotiated benefit strategy. A lot of these budgets were going unused or underutilized, and health plans and benefit brokers are partnering with SoHookd because we provide a high impact solution that's really solving a top business priority. So we know that there are a lot of other offerings in the market, but where we really differentiate and why we've been able to add so much impact and value is that number one, we are an all-in-one solution that encompasses both unique rewards and differentiated program. This is value to our enterprise customers because it's more efficient and effective to partner with one provider that they can serve them in multiple use cases, whether it's benefit, rewards, gifts, or engagement. Number two, we're the only ones who have built a proprietary marketplace that allows our enterprise customers to provide desirable, culturally complement, and offerings across a variety of affordability that resonates with the workforce and drives engagement. And number three, SoHookd is 100% well-being focused, which is valued to our enterprise customers because it helps to underscore an organization's commitment to well-being, which is a key metric used by today's employees to evaluate their employers. One of the things that really excites me the most is that I recruited this amazing team with deep expertise in wellness, consumer engagement, and technology. Not only does our team have the credibility and knowledge to tackle this problem, but also the mental strength, drive, and unrelenting commitment to unlock access to wellness for all. We have a team of rock stars who are really punching above their weight class to service well-known partners and customers like Aetna, United Healthcare, and Morgan Stanley. We're at the stage where it's clear we're on the path to becoming a dominant player within the wellness industry, and we are gearing up to raise our seed round to build the foundation for our next level of growth. In the process, we expect to expand, share, and enhance our global capabilities. We are really looking for strategic partners at this stage who are passionate about what we're doing and our movement, whether it's an investor, whether it's a customer, or whether it's a channel partner. Thanks so much, and we're really excited and hope you get SoHookd. If you want to contact me, feel free to contact me directly in any of those three areas.
Thank you so much, Vijay. All right, and last but certainly not least, we welcome Dr. Yared Alemu, an experienced psychologist, clinical supervisor, researcher, administrator, and founder and CEO of TQIntelligence. He is an expert in digital mental health care and using technology to support precision and individualized treatment approaches to mental health care. Striving to identify and treat mental illness early in a child's life, he is leading the TQIntelligence team in developing an algorithm that detects anxiety and depression in children with just a 60-second clinical voice sample. Dr. Alemu is working with providers, payers, policymakers, and families to improve the quality of life for young people collaboratively. All right.
Hey, everybody, there we go. All right, hi. So just a couple of things before we start. In terms of the order of presentation, I don't know, it's arranged by age or quality that you save the best for last. So I'll go with the quality one rather than the age piece. So I want to thank you, the Blue Cross Blue Shield team, Michelle and Jasmine. You guys have been amazing, as well as Healthbox and the Capital Network for supporting us this past year. So it's a pretty nice convenience to have. So what we, and I said, I'm the founder of and CEO of TQIntelligence. And so my experience in behavioral health care had a profound impact on me. And that's both personally and professionally. And so I was in therapy for when I came to this country, and not because of, I knew about therapy, just happened to go there. And so the impact is profound. And so the TQIntelligence idea was in supporting an affordable mental health care, regardless of whether you come from a certain zip code, ethnic background, sexual orientation. It's important that we make these affordable, quality mental health services to everybody. And mental health is right now is famous. There's not a week that goes by without an article or a 60 minutes episode. And that is because the system is in crisis, and the pandemic has intensified the severity of the suffering and the number of people seeking services. There's a dramatic increase. And the crisis is more acute for children from low-income families. And even before COVID. That is, a group that has been significantly impacted by trauma. And so, for example, you see suicide became the second leading cause of death for African-American kids between age 10 to 14. Right? Suicide used to be a problem of white people. And so that's a pretty dramatic change. And it represents about a 76% increase just in the last 25 years. And in 2020, there's about a 6,600 suicides that are completed, and which is pretty sizable issue. And part of that, and what COVID has also done, not just kind of highlight the suffering, it also exposed the human capital issue as it relates to the system, right? The system that the therapists are the least trained, they're the one who's providing services for the most severe, right? And despite the recent improvement in access via virtual care, we're moving into about a 225,000 therapy short by 2025. And we will definitely to exacerbate populations that already are suffering because of a number of issues that's been going on for decades. So this is, the reason why we created Clarity AI, and this is our solution, which is an augmented intelligence platform, right? So we're going to address the issues very specifically. So we use a 45-second voice sample and other scientifically validated instruments to quantify the severity of the problem, right? And then within the first 5 minutes of the counseling session, right, the therapist have an objective severity score, right, on the emotional distress of the child that they're treating, right? And that is intended to really increase the effectiveness of the therapist. And then furthermore, what we do is to address one of the probably the number one pain points for therapists, right? It has to do with documentation, right? So Clarity AI writes the therapy session note immediately after the session, right? So they collect the data, a number of them, including the voice sample. We give them feedback in real time that they can use for intervention. And when they finish, their note is completed for them. So we want to make sure that we're not just inventing something, but we do invent something that actually makes a difference for that system of care. In terms of the voice algorithm, so what we do is we are addressing 3 different key pain points. One is rapidly screening and triaging of patients with accuracy, right? And radically speeding up the decision-making process for care allocation. People don't have to wait for weeks someone to say, this is the level of care that they need. And that could be done within 5 minutes rather than 5 different weeks to figure out what's going on. We monitor patients remotely to make sure that the care continues outside of the treatment session. And then when there is a risk, we notify the therapist accordingly. And we also have customized public API to support families that they can go to this website, give about 45-second voice sample, and we will analyze and give them feedback in real time in terms of what their level of risk is, right? Can they wait until Monday to call the pediatrician, or they need to take Johnny to the emergency room today? So those things address a number of different issues in that system of care. We have many competitors. The things that is different from us is we're focusing on children and adolescents from low-income communities. So the barrier for entry to be able to develop solution for that area is pretty significant. And so in terms of the market, we'll begin by focusing on a subset of the Medicare managed care market, a market over about 500,000 providers and 5 million children with complex behavioral disorders. And we will expand to Medicaid use with unmet future needs, and then eventually move to the private healthcare areas and supporting families with similar solutions. While use account for about $45 billion in mental health services, our specific business model addresses about $2.1 billion market of about 35 million kids with current, future, and unmet needs, both Medicare and commercial population. And I'm assuming that we can capture 4% of this market, Right? We have a potential to earn about $100 million. And so far, we have raised about $300,000 in early stage funding, $1 million in non-dilutive grants from the National Science Foundation. And the National Science Foundation will be investing about $2 million before it ends in 2023. And we're planning to have 6,000 patients this year with $300,000 in revenue, and then grow that by 15,000 patients and $2 million next year. We have a great team, both healthcare, voice analytics, and the business of behavioral. So we feel very confident about it. And what we're currently looking for is strategic partners in regards to a paid pilot potentials. We plan to raise our seed round somewhere in, at the end of Q3 and Q4. So we'd be happy if you can join us for that journey. Thank you.
Thank you so much, Dr. Lemu. And thank you to everyone for your participation in the session, all 5 of you companies. Thank you so much. This does bring us to the end, but I hope that this isn't the end for all of you to be thinking about health equity, thinking about it on a daily basis. And hopefully, I really encourage you to interact with our startups and founders here today. They put a lot of work into what they've been doing, and they've had some fantastic successes that they've shared with you so far. And they're really just gearing up for more. And they're all in a really good position to support the organizations or the people or the past coworkers that you all have worked with. And so you heard from them today. I encourage you to reach out. We are going to follow up after this with an email thanking you with the contact information for the participants today. And I just hope that this isn't the end of the journey, whether it's your health equity journey or specifically with these companies today. They're looking for customers, investors, strategic partners. They want to share more about their mission, their capabilities, the outcomes that they've had. And so I just want to say thank you again to those 5 participating companies. Fantastic job. I also want to say thank you to Blue Cross Blue Shield of Massachusetts and Michelle and Jasmine for putting on this program. And we're really just looking forward to seeing all of the amazing things that come out of this. So thank you all very much for your time. We really appreciate it. And go be champions for health equity for the rest of the day. Thank you.